Hi, Javante. My name is Miss Brown, and I'm here to work with you today. Would that be okay?
Yes.
Okay, what I'm gonna do, I'm gonna go over to the sink and wash my hands before I come over, okay?
Okay.
And now that I practice hand hygiene, I'm gonna apply my gloves, okay?
Okay.
And then I'm gonna pull your curtain to provide some privacy, okay?
Okay.
All right. Javante, can you tell me your name and date of birth, please?
April 10, 2011.
And what's your name?
Javante Brown.
Can I check your armband to make sure?
Yes.
Okay. Great, Javante. All right. Do you have any pain or anything that you need to tell me about?
No.
Okay. So what I'm going to do, I'm just going to take a look at you and make sure everything is intact, your head, your ears, everything looks straight. And what I just did a facial assessment with Javante. Will it be okay if I touch your head?
Yes.
Okay, what I need to do is I just need to feel around a little bit, okay? And I'm looking for any infestivities. Javante hair seems like it's good. He don't have any facial hair, so I don't have to look there. His hair, no lumps, no signs of alopecia. So everything is good there, Javante, okay? Now what I'm gonna do, I'm gonna don my gloves and practice hand hygiene again. Now what I'm gonna do, Javante, I just need to feel around a little bit, okay, on your face. So now that I practice hand hygiene, I'm gonna feel his temporal mandibular joint, and I'm gonna ask him to, can you open your mouth like this and close? Okay, no abnormalities. Can you hold your head straight? Okay, can you open your mouth and close while I push down? Open and close. Okay, good. And the next thing I'm gonna do, I'm gonna have you, can you smile? Can you frown? Puff out your lips. Okay, so I just checked cranial nerve number 7, and Javante seems to be normal with all his facial expressions. So I'm gonna record my findings. Next, I'm going to I also checked cranial nerve number 5, which was his trigeminal nerve, and he seemed to be normal with that. So now I'm gonna wash my hands again, and I'm gonna put gloves on, practice hand hygiene. Okay. And Javante, I'm just gonna go here. Can you hold his head? I'm putting in a 45-degree angle. Tell me if you feel any pain there. Any pain?
No.
What I'm doing, I'm checking his maxilla, and then I'm gonna take my hand here and press against his frontal. Any pain?
No.
Okay. And so I'm gonna record my findings, and it seems normal with no pain, no abnormalities, no abrasions or anything on Javante's head. So next I'm going to go to his olfactory nerve, and I'm going to check his eyes. And what I'm going to do here is I'm pulling down his eyes. Can you look up for me? Can you look down? So open your eyes wide. I need you to open wide. Okay, look up. And what I'm doing here, I'm looking for any conjunctivitis or any redness or anything. It should be pink and his look normal. Next, what I'm gonna do, I have my light here. What I need you to do, Javante, I need you to follow this pen, okay? And what I'm doing here is checking his ocular motor nerves. I'm sorry. So what I need you to do is, without moving your head, okay? Don't move your head, just your eyes. Follow the pen. And so I just checked his olfactory his olfactory motor skill nerve, and he seemed to be normal with that. The next thing I'm gonna do, Javante, I'm gonna take this pen and I'm gonna go straight to the nose, okay? Don't try not to move your head, okay? Just your eyes. Okay, what I just did there, I checked his pupils, his eyes to make sure that there was no jugular, no shaking or none of that, and that's normal. And I'm gonna record my findings with that. Next, what I'm gonna do, I'm gonna turn down the light. And what I need you to do, Javante, is stare off straight there. Okay. And what I'm gonna do, I'm checking his pupils to make sure that his eyes isn't dilated, that there's no abnormalities with his this open wide, the pupil, that his eyes are in normal range, which should be 3 to 5 millimeters apart. Okay, just open wide, Javante. You gotta open wide. Okay, I'm gonna take the light and come from the side. Open wide. Stay wide. Good. His pupil look about 3 millimeters. No shaking. And so that looks normal. And what I'm gonna do here, I'm gonna record my findings in his eyes. There seems like no shaking. Open your eyes. There's no shaking, no abnormalities there. So now I'm gonna turn my light back on. And I'm going to don my gloves, practice hand hygiene again, and then I'm gonna apply a new set of gloves on. Next, what I'm gonna do, I'm gonna check Javante. I'm gonna palpate here, his ears, to make sure that his ears are normal. They're measured with his body. And I'm going to take a laryngoscope, which is my light here. But what I'm going to do, I'm going to check his ears here to make sure that there's no abrasions on his ears. I'm going to go back here to the here, and then I'm going to look into your ears, okay? And I have a light. Normally what I would be doing, I would be looking to make sure that the inside of that ear is on the right here is set at 5 o'clock. And then I'm going to come around here and check his left side of his ear. And make sure that is set at 7 o'clock. And I'm going to record my findings. No ear drainage, none of that. And the next thing I'm going to do, I'm going to ask Javante to, can I take the light and look into your nose? Okay. Can you hold that one and blow? Blow. No mucus, no drainage, none of that. Okay, I'm going to take this and I'm going to look here. Can you blow? Okay, no drainage, no liquid, none of that, so that is normal. Okay, and I checked, so far I've checked Javante's abducens, I've checked his olfactory, I checked his oculomotor. I actually did all three, 3, 4, and 6 nerves together when I checked his eyes. So the next thing I'm going to do, I'm going to record my findings. What I'm going to do, I'm going to whisper a word over here and you tell me if you can hear me, okay? What I say?
Apples. Apples.
Okay, and so Javante hearing is good. So that nerve that I checked, his auto nerve is working pretty good. So the next thing I'm going to do, I'm going to record those findings as normal. The next thing I'm going to do, I'm going to take my, this is a stick to check your mouth, but so can you go open your mouth? Okay, and I'm gonna hold his head to a 45 degree, and I'm checking his lips. That his lips are pink. His skin color is the way the color that it should be. No abrasions on his lip. No deviations of any abnormal things that should be out of the abnormal. So what I'm gonna do, open. Can you hold your tongue out? Put it back in. Okay. Now I'm gonna check the side of his jaws. Check him there. His teeth, no cavities. His teeth are great, open wide. Now what I'm gonna do, his glossopharyngeal nerve, I'm gonna, can you stick out your tongue? And open. You gotta open. Hold your head. You gotta open wide. His gag, his glossopharyngeal. So I checked that and he kind of jerked back. And so he seems like he's normal. Not seem, but that check was normal. So I'm gonna disregard my stick here, and I'm gonna record those findings as being normal. I'm gonna disregard drawing off my gloves again. Then I'm going to practice safe hygiene, and I'm going to grab me a new set of gloves. There was no deviations. Okay, so now I'm going to check his cranial nerve number 11. So what I'm doing here, I'm holding him at a 45-degree angle, and then I'm going to ask Javante to turn his head. Can you turn your head to the right? Can you turn it to the left? Can you go up and down? All right, so I just checked his cranial nerve number 11, and that was normal. So what I'm going to do, I'm going to record those findings, and then I am going to go ahead and palpate Javante. And what I'm going to start here, when I with my palpations, I'm going to palpate his pre-articular. Any pain? No hurting? Okay, and then I'm going to go to the post-articular. And then, any pain? No abnormalities. Okay. And then I'm going to go to his jugular. Parietal here. Jugular. It's submandibular. his submandible, no pain. Superficial cervical, deep cervical chain. Feeling here for his posterior cervical. Then right above his clavicle, I'm gonna go to his super clavicle. And everything seems normal. Good, Javante. Next, I'm going to check Javante carotid artery. And what I'm going to do, can you lift up? Before I check his carotid, I'm going to look at his cervical here. And that seems normal. Okay. I'm going to press here. Good. 2+, that's normal. Now I'm gonna come here, press here. And that's about 2+. Next thing I'm gonna do, I'm gonna take my stethoscope and I'm gonna listen for Javante with my bell here. And I'm just gonna take this and place it here. Can you breathe in and breathe out? Breathe in, one deep breath, and breathe out. And I'm checking his cervical carotid. Just one time. And I'm going to, can you breathe in and breathe out? One deep breath, in and out. Good. That was 2+. And with that being said, if there was something wrong, I would hear some swishing or something going on in his neck, and that was normal. And that is how you take a head and neck assessment.